upper trap pain and tightness is probably your breathing that we're talking about. That's the subject of this video, so stay tuned. Hey, this is Dr. Shaki from Irvine Spinal Wellness Center, your Irvine Posture Movement Chiropractic Clinic. We're talking about upper trap. Everyone, pretty much everyone, has tightness of it, and over time that tightness becomes pain. So other than the fact that, we're behind our devices way too long, one thing that goes hand in hand with that and ultimately leads to or feeds the problem of upper trap being tight and becoming painful is breathing. What ends up happening is you're collapsed here from doing this. Your shoulders are rolled forward, and in the process of all that modification, not in a good way, of your posture, your breathing apparatus becomes compromised. So in reality, in a healthy biological way of breathing, it's the pelvic diaphragm that signals from the abdominal pressure going upward, signals the pelvic diaphragm, signals the abdominal diaphragm to push up, evacuate the air in the lungs. When that connection is compromised because you're collapsed over your abdominal diaphragm, the thing that will cue the diaphragm here to go up is not coming from the pelvic side. It becomes the neck and in essence the upper trap and the collarbone that kind of goes up. The collarbone, the muscles connected to it, goes upward, which goes there, and it's in very minute way lifts you up just enough for the diaphragm to get the cueing to breathe out. So in a way, you have modified the very smooth operation of breathing in and out. So you're feeding the problem, and part of that problem is your upper trap. So instead, you gotta take the time to actually undo some of the damage, and most importantly, can the whole idea and the whole setup that feeds the problem. So sitting on an exercise ball is important, very important. Alternating between sitting and standing is important. Making sure that you're not sitting for 2 hours, you get up every 55 minutes is important. And thinking about your xiphoid, where your ribs come together and get connected to your chest bone, thinking about it not coming out like towards the camera, but going upward towards the ceiling. So when you do that, you're not sticking your chest out, you're making the collapsed xiphoid go upward. And then it's your neck gliding back that keeps the whole system and basically reinforces you staying there. So this is the mindful way of practicing it. And then you go use things like postural neurology, the neurology behind your posture, and the correction of how, as a result of this collapse, things have been modified to bring them back to the original design. Now we're talking about functional movement, things like DNS and this stuff that we do at the office. If you want to understand what DNS, what postural neurology is, check out our description box below and you can learn more about it. But I just wanted to bring to your attention that tension doesn't just happen for no reason, and then we not only need to address the problem, we need to address the things that feed the problem as well. Hope this helped. Thanks for watching.